We will talk about worms in children, and when we say worms, we mean literally small worms which live in children's intestine. They interfere and affect food metabolism in intestine. They consume the food. They can cause malnutrition of kid, and they can cause delay of growth of kid and interfere mental development also. That's why we pay important attention worms in children. Such parasitic infections generally is called helminthiasis. Helminthiasis is very common, and general population has 50% lifetime risk of helminthiasis. It means that half of population will be infected at some point of their life with this worm infection. Now let's say which is most common worm infection and how we can recognize it and how we can treat. Pinworm infection is the most common worm infection in developed countries. These are small white worm you can see here, and most important symptom among kids is itching around anus. Itching happens because this small worm comes out from anus during night time to lay eggs on the skin, on the perineal area, and it causes irritation of skin, and we have itching. Itching is most important symptom. Sometimes parents see also the small visible worms on the skin, on the clothes, in the stool, and sometimes kid has abdominal pain also. But it can be without abdominal pain also. But most important symptom still is itching around anus. And diagnosis is based on symptoms plus tape test. Symptom, as we said, it's itching around anus, and tape test means we have special tapes, and this tape is pressed against the perineal area and taken and examined under the microscope, and we're searching for these pinworm eggs. Sometimes in the stool there is no pinworms or pinworm eggs. That's why stool examination is not very accurate. That's why tape test is most important informative test. What is treatment? Treatment is antiparasitic medications. Albendazole single dose is enough in many cases, and also sometimes after 2 weeks another dosage is given. So albendazole 1 single dose or 2 dose, one at first and second dose is after 2 weeks. Same regimen is mebendazole also. Usually albendazole is first line treatment and or mebendazole, and this treatment is highly effective. Also, it's important to wash bed linens, towels and underwear in hot water to kill these worm eggs, and hygiene is important also. Frequent washing of hands is important, and it's recommended that when kid is treated with albendazole or mebendazole, other family members also should be treated with these medications, because the pinworms is very it has high infectivity, it spreads very easily. That's why other family members should be treated also. Now let's say second most common worm. Actually, it's most common worm among developing countries. It's Ascariasis. And what is most important symptom of Ascariasis? It's abdominal pain. If in pinworms we have perineal itchiness, most important symptom, in case of Ascariasis, most important symptom is abdominal pain and loss of appetite. These Ascariasis worms are longer in size and larger in size. They also live in intestines, and they have several stages, and in larval stages they can migrate to respiratory system and cause coughing and wheezing, but this coughing and wheezing is not very prominent, and it can be skipped because of short period of nature, and this stage will end, and most important symptom still is abdominal pain. Diagnostic methods and diagnosis is based on examining stool for eggs in stool. That's the diagnostic criteria, the most important. We can see high eosinophils in blood, but high eosinophils in blood is general test and general indication of parasitic infections. They are not specific for Ascariasis. Eosinophils are increased in case of other types of worm infections also, and parasitic infections also. So sometimes blood tests are also made, but gold standard for diagnosis is examine the stool for eggs. Treatment is same, albendazole and mebendazole. Albendazole single dose is enough in many cases. Sometimes mebendazole is given for several days. It depends, but these treatments usually are very highly effective. Third most common worm infection is hookworm infection, and hookworm infection causes itchiness of foot in many cases. It's infection area of skin, you can see here, and it causes itchiness and irritation of skin, and this larva migrates in the blood and then in respiratory tract, then it is swallowed, and eventually this hookworm will grow into intestines and lives in intestine. Albendazole and mebendazole is same treatment here also, and treatment is very effective also. Schistosomiasis is another worm infection. It's much rarer, and abdominal pain is common symptom, diarrhea, fever, muscle ache, cough also, and praziquintal is a treatment. And cysticercosis is also rare worm infection, and its important form is neurocysticercosis, when this larva migrates into brain and grows there, and it can cause neurological symptoms. Treatment is same, albendazole and mebendazole also in case of cysticercosis. To summarize, this worm infection is very important among kids. Pinworm infection is very common in developed countries and most common infection. Ascariasis is most common in developing countries, and hookworm, schistosomiasis, and cysticercosis are rare forms of worm infections in kids. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.